Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, I am going to explain to you how blood circulates in the heart. Before we understand how blood circulates in the heart, let us study the anatomy of the heart. The heart is made up of two upper chambers known as the atria, the right atrium and the left atrium. We have the ventricles, the right ventricle and the left ventricle. From the right ventricle, the pulmonary artery takes the impure blood into the lungs. On the left side, we have the aorta, which supplies the oxygenated blood to the rest of the body. As you can see, the right side of the heart is depicted in the blue, or it's generally a purple color, representing deoxygenated blood. That means the oxygen that has been removed by the tissues before it returns to the heart. Whereas on the left side, it is red because it is fully oxygenated blood. When the blood is from the right side into the lungs, the oxygen in the air is mixed with the blood to improve the oxygen level in the blood, and that's why the left side is represented by the red color. There are valves here which prevent the blood from going backwards. When the ventricles are contracting, we don't want the blood to be going back into the atria, and that's why there are valves which prevent the blood from leaking backwards and help to move the blood forward. This is one of the most important functions inside the heart, that is, the blood moves in only one direction. So we have the tricuspid valve on the right side between the atrium and the ventricle. We have the mitral valve on the left side between the left atrium and the left ventricle. Then we have the pulmonic valve, which prevents the blood from leaking backwards at the pulmonary artery level. Then we have the aortic valve. So let us talk about how blood circulates in the body. The impure blood from the lower extremities, the abdomen, comes to the right side of the heart through the inferior vena cava, as it is shown here in purple. The blood from the head and neck comes through the superior vena cava into the right atrium. The blood is mixed here in the atrium, and when the atria contracts, it is squeezed into the right ventricle. When the right ventricle begins to contract, the tricuspid valve closes, so there is no backward flow, so the blood is forced into the pulmonary artery. The pulmonary artery divides into the left pulmonary artery and the right pulmonary artery. These pulmonary arteries further subdivide into tiny branches where they supply the alveoli or the air sacs where the blood gets oxygenated. Once the oxygenated blood comes through these pulmonary veins, as they are called, even though they are called veins, they are red because they are carrying the oxygenated blood into the left atrium. And when the left atrium contracts, the blood is squeezed into the left ventricle. When the left ventricle, which is the main pumping chamber of the heart, squeezes, the mitral valve closes, so there is no backward leak. So the blood is pushed into the aorta, and from there it is distributed to the rest of the body. Here we have three blood vessels that supply the head and neck. Then the aorta comes down here and divides into branches, and it goes into the belly where it gives several branches. After that, it divides into the right and the left iliac arteries, which supply both lower extremities. The impure blood from the extremities and trunk comes through again into the inferior vena cava, and also the blood from the belly. Then from the head and neck, the impure blood comes through the superior vena cava. So this is a very quick synopsis of how the blood circulates in the body. I have several hundred videos on patient education about heart and heart disease. If you want me to research on any particular topic, I will be more than happy to research and create a video so that you will be able to understand much better about heart and heart diseases. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. I will see you in the next presentation.